Hello friends, today we're going to discuss about Narcissistic Personality Disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about Narcissistic Personality Disorder, diagnosis, prevalence, and management. If we look into the clusters of personality disorder, Narcissistic Personality Disorder falls into cluster B. Let's understand what is this Narcissistic Personality Disorder. Individual with Narcissistic Personality Disorder, they will have grandiose, self-loathing, extroverted, socially isolated, unable to maintain steady employment are the cardinal features. If you look at the various types of narcissistic personality disorder, there are 5 have been described. However, these are not part of the official classificatory system. Invariably, many of the clinicians, psychologists have given this differentiation or the types of narcissism. These are grandiose or overt narcissistic behavior. These are the people who are outgoing, arrogant, and self-boasting person. Vulnerable and covert narcissism. These are the people who are introvert, submissive, and boasting person. Malignant narcissism. Here, these people will have manipulative, aggressive person with narcissistic personality traits. Somatic narcissism. These people focus on more on their looks, appearance, and criticize other people. Cerebral narcissism. These are the people who feel they are intellectually superior than any other person, although the contradiction is there with regard to their cognitive abilities. Let's look into the DSM-5 diagnostic criteria for narcissistic personality disorder. There should be a pervasive pattern of grandiosity, need for admiration, lack of empathy, and these symptoms should be present in variety of the context of life. And they should have at least 5 symptoms out of 9. Let's look into this. First one is they should have a grandiose sense of self-importance, which is very essential for the diagnosis of narcissistic personality disorder. They are preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. They believe that he or she has a special, unique powers and can also be understood only by the unique or special people. They require excessive admiration. They also have a sense of entitlement. They also interpersonally exploit other people. They lack empathy. They are unwilling to recognize or identify the feelings and needs of others. They often envy others and believe that often others are trying to harm them. They show arrogance, haughty behavior, and attitude towards others. Let's look into the prevalence of histrionic PD. It is somewhere around 0 to 6.2%, my dear friends. If you look at the comorbidity, depression, suicidal ideas, substance abuse, and anxiety disorders are the common with narcissistic personality disorder. Narcissistic personality disorder must commonly co-occur with antisocial personality disorder, borderline, schizotypal, and passive-aggressive personality disorder, and they become very difficult to treat. Comorbid antisocial personality disorder and narcissistic personality disorder has a profound negative outcome with regard to prognosis of these 2 disorders. Let's look into the management of narcissistic personality disorder. The diagnosis of NPD can be done by a good clinician who is able to take a good clinical interview, collect information from multiple sources, observation, and also mental status examination. Projective test can also be used. Various scales such as PI, SCID-5, MMPI-2, MCMI-3, and PDQ-4 can be used. Further, narcissistic personality inventory can also be utilized for the diagnosis. Treatment of NPD. Like any other personality disorder, the treatment is pharmacological and psychotherapy. Unfortunately, with regard to narcissistic personality disorder, we do not have any research with regard to treatment aspects. RCTs and open label trials are hardly very few. Hence, we cannot give a evidence-based recommendation for treatment. That means the treatment of narcissistic PD is based upon clinical and clinician experience. Hence, invariably, the psychotherapy can be considered as the first line of treatment. Even in therapy, the narcissistic personality disorder will show resistance. Hence, we need to start with supportive psychotherapy. In supportive psychotherapy, we need to have a unconditional acceptance, provide encouragement, build rapport, and then slowly start working towards the resistance. And also, you need to deal your own countertransference. Once the rapport is built, the narcissistic personality disorder will work with you through their therapy. However, the medications are available only for treatment of comorbidities. To conclude, my dear friends, there are hardly few studies with regard to narcissistic personality disorder treatment and course and outcome. There are various subtypes have been indicated with regard to narcissistic personality disorder. Unfortunately, they are not part of the classical standard treatment guidelines or classificator system. Psychotherapy is the first line of treatment in narcissistic personality disorder. Thank you very much for giving your valuable time. Stay safe.